My inspiration for becoming a physician goes back to my childhood. So my dad is a family practice doctor, and I grew up in a small town in northeastern Nebraska. And I just love the interaction and the difference that he got to make in a lot of people's lives. Interventional pain was never on my radar when I was deciding what to do in terms of medicine. It was one rotation and a mentor that really triggered the light bulb in me, because a lot of times patients think that they have pretty minimal options, such as a steroid shot. If that doesn't work, then they need to have surgery. But there's really a lot of in-between options now that are available that really weren't available just 5 years ago. My journey back to Rapid City was through a lot of different states, and took the COVID pandemic to get me here essentially. I did my fellowship in North Carolina, having done all my primary training in Nebraska. Found a great job in Missouri with 4 neurosurgery partners. Had an amazing experience there. But we found that every vacation we were coming back to Rapid City to spend time with family. And it took the COVID pandemic really shutting down my clinic for a month to just think and really make the decision with my wife to just move back to South Dakota. We love the hills. We love to be active. We love to hike. We love nature. We love the proximity to a lot of different activities in the area. And we're really just small town people at heart. So this is a great city, great school system. Our kids feel very safe here. It's just a great place to live. So outside of medicine, I have a lot of hobbies, and some of those have gone by the wayside as we have more kids. We have 4 kids currently, and not planning on any more. But my hobbies are general aviation. So we have a small airplane at the Sturgis Airport, and I love to fly it. It's challenging and it's different than anything that I do. We love to get outside into the hills. We love to ski and snowboard. We love to travel and see the country. Especially the national park systems are definitely on our bucket list. And then my wife is from Vienna, Austria, so we take a trip to Austria once or twice a year to see family. So aviation's always been a passion of mine. I kind of grew up with it. I got my pilot's license when I was 17, just shortly after my driver's license. We would go to a conference in Oshkosh, Wisconsin every year called the EAA, where people actually build their airplanes. They build their airplanes, then they fly them to Oshkosh, Wisconsin. And we really just got hit by the aviation bug, my whole family. We built an airplane in 2012 through a standard kit process. And the only thing we didn't build was the engine or all the avionics, all the gauges that tell you where you're going and what's going on with the airplane. And we've flown it to Oshkosh several times. We have over 1,000 hours on it. It's been running beautifully. It's an amazing feat to think, you can start with one rivet and put together an entire airplane. It's been life-changing, and it's been a great break from medicine and from the day-to-day responsibilities of being a doctor. When someone thinks about interventional pain management and Dr. Ptacek, I would like them to just think of a positive experience. Our front desk and our nursing staff are friendly. Our nurse practitioners here want to help, and we really want to have a mutual relationship with the patients, where patients have input, we have input, and we come together to find a solution that works. Patients really know what's wrong. They're living in their body in terms of pain and symptoms, so I spend time up front asking the important questions, trying to figure out what the goals are of the patient. Everyone has different goals. And then basically do a really good job at diagnosing, offering treatment options, and then just seeing what the patient desires. I feel like if I can lay it out in that stepwise fashion, then we can achieve more attainable goals. So when patients come for the new patient visit, they'll be fairly surprised that there is quite a bit of paperwork. And what we try to do is we try to detail the previous history. We try to get all of the information, medicines tried, treatments tried, physical therapy tried. And then basically, we try to come up with a pretty thorough plan on day one. A lot of times there's a couple of follow-up visits to really nail down where the pain is coming from, and then to offer long-term treatment options. But what I would expect patients to have walking away from an office visit with me is a clear understanding of what's going on and then numerous options to try to treat that.